Welcome to What is Care? My name is Rhiannon Thorne. This presentation will help you to understand what is expected of you when you work in social care. Understand how the code of conduct and best practice underpins social care and how we support individuals. What does care mean to you? You might think of words such as helping and supporting, or looking after, doing with the person, or working with a person with disability, keeping people safe, or helping someone to do it themselves. Who might access care services? People with a physical disability, or hearing or sight difficulties, a person with terminal illness, or a person who's developing or have confusion or dementia, a person who's frail, a vulnerable person who's risk of neglect or abuse, a person who has a learning disability, a person who has mental health problems, a person who is leaving hospital, or a person who is a carer. This can be more complex if you consider some people may also have substance misuse, might be a victim of abuse, could be living in poverty. Some people have behaviours that are very complex and difficult for us to understand. They may have communication and understanding difficulties. People who receive care services will have an initial assessment to identify well-being needs. This assessment will inform the care and support plan. And because things change, the plan will be monitored and reviewed regularly. The type of activities you could be involved in when you work in the care sector perhaps would be supporting personal care and supporting medication, assisting people with eating and drinking and with the domestic tasks. It could be that you're maintaining people's health and well-being, helping them to aid recovery from an illness, maintaining people's identity, such as supporting people perhaps to be involved in religious services, helping them to gain and regain and maintain skills, social, emotional support, helping people keep in touch with family and friends, supporting family members, promoting independence and inclusion, and access to recreation activities, maintaining hobbies and interests. All care workers in Wales are regulated by Social Care Wales. The Code of Professional Practice for Social Care Workers says that you must respect the views and wishes and promote the rights and interests of individuals and carers. This would include supporting people to make decisions, respecting the language and their identity. Secondly, you must strive to establish and maintain the trust and confidence of individuals and carers. This would include being open and honest, using preferred language, respecting confidentiality, not accepting gifts, but if you're unsure about this, ask your manager for advice. You must promote the well-being, voice and control of individuals and carers while supporting them to stay safe. This would include working with individuals to keep themselves safe, promoting their well-being and control over their lives, supporting people to raise concerns. You must respect the rights of individuals while seeking to ensure that their behaviour does not harm others or other people. This could include working with a person to consider and balance risks, ensuring that you follow policies and procedures, and help to minimise risk to self and to others. You must act with integrity and uphold public trust and confidence in social care profession. You mustn't abuse, harm or exploit individuals. Do not form inappropriate relationships or discriminate, or behave in a way that would call into question your suitability to work in social care. Lastly, you must be accountable for the quality of your work and take responsibility for maintaining and developing knowledge and skills. This would include following policies and procedures, be open and honest when things go wrong, and seek support if you do not feel equipped or you're not sure how to proceed, undertake training to complete your role. Values and rights when working in care. They include promoting a person's well-being, the state of being comfortable, happy and healthy. When receiving care services, people have a right to their well-being being considered, and while people have a responsibility for their own well-being, it's recognised that some will need help to achieve this. Voice and control. People have a right to a strong voice and greater control over the support and services they receive and the things that matter to them. Having control could mean that care services enable people to make the most of their skills and resources to support their own independence. For example, supporting a person to do their shopping online. Prevention and early intervention. This is supporting people at an early stage to enable them to avoid or delay intensive support. And finally, co-production means that the person who uses the services are seen as equal partners. It's important to break down barriers between people who use services and professionals. Collaboration will take place, and this approach is when groups come together to share their knowledge and ideas around how to deliver care services. Best practices when working in the care sector. Person-centred approaches. This is a way of working that fully recognises the uniqueness of each individual. And we use this information to plan how care needs of people can be delivered. To work in a person-centred way, communication is key. The use of effective communication enables you to build relationships with the individual. It alleviates their loneliness and helps maintain their sense of identity. It builds their self-esteem, and having good communication reduces the risk of abuse and reduces the risk of mental health issues for the individual. The key features of effective communication include listening carefully to the person. Have their full attention before you communicate. Make sure that they're looking at you and they look like they're listening to you. Pay attention to yours and the individual's body language. Are they smiling and nodding? Speak clearly and slow down your rate of speech. Consider other factors such as noise distractions. Does the person have their glasses on? Are they clean? Use physical contact to reassure if appropriate. We don't all like physical contact, but if someone is distressed, physical contact can help. Show respect when you're communicating and use preferred communication methods. This might be using the preferred language or might be using sign language or Makaton. What skills are needed to communicate effectively? Listening. Being a good listener is one of the best ways to be a good communicator. Non-verbal communication, so your body language, eye contact, hand gestures and tone of voice. Be clear and concise. Show friendliness when you're communicating. Show confidence in what you're saying and have empathy with the person. Be open-minded, respectful and feedback. Ways to overcome barriers to effective communication. Communicate when the individual is ready. Give sufficient time for the conversation, take breaks and allow the individual to regroup if they become confused. Make sure where you communicate has sufficient light and quietness to enable the communication to take place. Confidentiality. You must respect confidential information regarding individuals, carers and families at all times. You should not share information about anybody else, even with the person's family or friends, without the individual's permission. Increase risks of breaching confidentiality, for example on social media. Professional boundaries. A care worker should build relationships based on trust, as we will know intimate and personal details of the individual. Trust will develop and so will relationships, and becoming close is natural, But remember, your role is as a professional, not a relative or friend. There is a line we do not cross. For example, inappropriate contact, being too close, matey language, or discussing your private affairs, asking the individual's personal help, or borrowing things. More than just words, the active offer. The principle of the active offer is providers shouldn't wait for individuals to ask for the Welsh medium provision. Instead, they should actively identify the language needs first. Making Britain fair and equal for all. The Equality Act helps many of the different groups of people who sometimes get treated unfairly. They include women and men, people of different races, disabled people, people with different religious beliefs or with no religious beliefs, people of different ages, lesbian, gay, bisexual and straight people, or people who have changed their sex. When supporting people, you need to ensure that you show dignity and respect. You can do that by using the person's preferred name, always asking for permission, let the person know what you are doing at all times, and do not treat an adult as a child, and never ignore the person. Respect, preference and choice. Everyone is an individual, and we give as much choice as possible. People have a right to make a choice that you do not agree with, but you must give information so people can make an informed choice. Do not try and force the person to make a choice that suits you. Promoting trust and privacy. Do not gossip about the person or gossip in front of the person. You respect people's property and their belongings. Ask before you move, perhaps their handbag. We close doors, such as bathrooms, toilets and bedrooms. And we never make a promise we cannot keep. Promoting independence. Encouraging and assisting people when needed. Asking the person what help they would like and when they would like that help. Make sure the person has the equipment they need, such as walking stick, glasses. Enable the person to take reasonable risks. Qualities needed when working in care. You need to enjoy working with people. Every day can be different and challenging, so you need to be calm under pressure, patient and sensitive. You need to be non-judgmental and respect people's privacy and show empathy and understanding. You will need to be able to work as a team, follow instructions, but also to be able to work on your own. You need to be problem-solving and creative. Have good communication skills and be a good listener. You will also need literacy and numeracy skills. Finally, you will need to be kind, gentle, smile and listen. Thank you for listening.